This video now is going to continue our discussion on lipids. In the last video, if you remember, we put together a phospholipid with a glycerol and a phosphate group, okay? And our phospholipid also had a saturated fatty acid and an unsaturated fatty acid, okay? And in terms of that molecule, what that's going to do is that's going to impart a portion of the molecule that is going to be hydrophilic and a portion of the molecule that is going to be hydrophobic. Okay? And what that's going to do with our cell membranes, because that's where we're going to be concerned with phospholipids, is those phospholipids are going to be the component of the cell membrane. And I'm going to draw things a little bit differently here just because it's faster. Okay? This is going to be our hydrophilic glycerol and phosphate head. And then I'm going to draw the tails as two squigglies here because that's what your textbook does. And it's just easier as far as drawing to do it this way. But what I do want you to know is that phospholipid does have one saturated fat and one unsaturated fat, because that's going to become important when we talk about the cell membrane in more detail. Is having that unsaturated fat there is going to be what's going to allow other things to be in the cell membrane than just phospholipids. For now, we're just going to talk about the phospholipids though. And our pink area is then going to be the hydrophobic regions. Because what happens with hydrophilic molecules are going to want to orient themselves to where water is. And inside and outside of your cell, you've got an aqueous environment, so you've got water there. So the hydrophilic portion is going to orient itself that way. Hydrophobic wants nothing to do with water, so those hydrophobic tails are going to kind of all group together. And what that does is that creates what's known as a phospholipid bilayer that makes up your cell membrane. So phospholipid is what it's composed of. So one phospholipid would be the green head and the pink squiggly tail, okay? That phospholipid bilayer makes up your cell membrane. And you may see it used interchangeably, and sometimes I will use the terms interchangeably also. Either is fine or correct as far as terminology. This makes up your cell membrane or your plasma membrane. All right? So in terms of the cell membrane, what I want you to know about the phospholipid, you've got a glycerol, a phosphate, a saturated fatty acid, an unsaturated fatty acid, and a portion of it's hydrophobic, portion's hydrophilic. That's what allows the cell membrane to orient itself, okay, and essentially form a barrier that's needed to make up our cell. All right, so in terms of that, those are the phospholipids and the cell membranes. And in terms of the cell membrane, there is more found within the cell membrane than just the phospholipids, okay? You are also going to have some cholesterol that's found in your cell membrane as well. Cholesterol is going to be our example now for our steroid. Okay? And in terms of cholesterol, again, I think I've got the cellular structure in the notes, in the PowerPoints, or a better cellular structure than what I'm going to draw here. But essentially what you've got with cholesterol is you've got a series of rings. 1, 2, 3, is that 6? 1, 2, 3, 4, 5, 6. Okay. You've got 6-membered rings and 1 5-membered ring. And then you've got kind of a carbon tail that comes off of the end. Okay? But what's unique about cholesterol, those ring structures, are going to be the hydrophobic. The hydrophobic component of cholesterol. Okay? And what that'll do in terms of our cell membrane when we talk about this, it's going to orient itself inside the plasma membrane like that. So the rings are going to want to associate with the hydrophobic tails of the fatty acid. Okay? This is what I mean when not all fats structurally are going to be the same. You don't have repeating monomers associated with the lipids like you do with the other macromolecules. Okay? But cholesterol is important because it's a component of the cell membrane, but it is also the precursor for making various hormones in the body, specifically testosterone and estrogen. Okay? So we need some cholesterol as part of our diet. Again, with the Americanized diet, we get a lot more cholesterol than we actually need. But we do need some cholesterol in our diet to help keep our cell membranes together and also to make hormones like testosterone and estrogen. Okay? In terms of those hormones, this is also going to be what anabolic steroids are composed of. If you know somebody who's bodybuilding and they talk about taking steroids, not a good idea, okay? What those steroids do is they mimic, in the case of anabolic steroids, they're mimicking testosterone. And what it'll do in men who take anabolic steroids is it shuts off the feedback loop in the brain, and their body will no longer make testosterone, okay? And in addition, anabolic steroids can have some detrimental behavioral symptoms associated with it. If you've heard of roid rage, that's what they're talking about. Men who use anabolic steroids. It can happen in women as well, because some women will use anabolic steroids to try and build muscle, because that's what the anabolic steroid does. It's a synthetic version of testosterone. It helps build muscle and bone. All right? So ladies, if you've ever wondered why men are more muscular than women, it's a hormonal difference. Okay? Now, in terms of that, we as women, we do make a little bit of testosterone. Men, you make a very little bit of estrogen. The bulk of testosterone, typically, we associate that with male. Estrogen, we associate with female. But each gender makes both hormones. It's just in different amounts. Okay? But it builds muscle and bone. That's why when men go and bodybuild, they have an easier time building muscle than women who bodybuild or try and increase muscle mass. Okay? Anabolic steroids, taking that will increase muscle, it'll increase bone mass as well. Okay? But it causes health problems. Okay? Specifically, liver cancer is prone to people who use steroids. Brain cancer is also. You've got the behavioral defects that happen as well. So you might be sitting there watching this video going, well, why did anybody even, why do we still have anabolic steroids? What function do they have? And in terms of overall health, they do actually have a clinical application, okay? That clinical application is for folks who are suffering from HIV or, ironically, late-stage cancer. Because remember, I told you here, one of the side effects of using anabolic steroids long-term is cancer. But folks who have cancer due to other causes, so breast cancer, skin cancer, pancreatic cancer, you can pick the cancer. Anabolic steroids build muscle and bone. And late-stage cancer patients tend to suffer from muscle wasting. So their body starts breaking down muscle. The anabolic steroid will help prevent some of that from happening. So it does have a clinical significance to use anabolic steroids, okay? And that's where the clinical application is, okay? Now don't confuse the anabolic steroids, just real quick as a side note here. There are also catabolic steroids. So if you've ever taken something like prednisone, prednisone is a catabolic steroid. Not going to build muscle when you're taking a catabolic steroid, all right? This one will actually break down body components, but really the catabolic steroids like prednisone are given because they suppress the immune system. So typically if somebody has a disease that's associated with an overactive immune system, catabolic steroids can be given to kind of dampen the immune system to shut that down. These also then are a clinical treatment. All right, so there is a difference between catabolic and anabolic steroids. Both are going to have side effects long term, okay? But both do have a clinical relevance, all right? Hopefully that makes sense. If you have any questions, please let me know.